I'm Meredith Bond with a City News exclusive investigation. At least 2 post-secondary schools in Toronto, including George Brown, don't make naloxone kits available to students on campus. These kits can be the difference between life and death for someone experiencing an opioid overdose, and their distribution is a key component of the province's strategy to combat the opioid crisis. City News reached out to the 5 colleges and 4 universities in the GTA to find out what resources they have available for students amidst a crisis that has claimed over 1,200 lives across the province last year, a 45% increase from the year before. George Brown is one of the 2 post-secondary schools that does not have naloxone kits currently available for students. This despite the school's downtown campus being just a few hundred meters away from the Moss Park safe injection site. In a statement, George Brown tells us, "We know that increased awareness of and access to naloxone can save lives. That's why we have approved a plan to put naloxone kits on all of our campuses. Details of their plan have not been released." The other school without naloxone kits, Centennial College. A spokesperson there says the school is currently working on plans with a local pharmacy to offer education sessions and naloxone training to be offered in the near future. 3 schools we reached out to did not provide any information on their opioid prevention programs. It's not clear if naloxone kits are available on the University of Toronto, Humber College, or OCAD University campuses. Ryerson, York, Sheridan, and Seneca are 4 of the schools equipped with the life-saving drug. For more on the policies and programs implemented on those 4 campuses, head to our website at citynews.ca.
Have you heard about a naloxone kit?
What?
A naloxone kit?
No, I haven't. What's that?
I'm Maliha Sheikh. It's Frosh Week here at Ryerson University, so students are out and about having a good time, as they should be. But with all the focus being put on fun Frosh Week activities, is the issue of drug overdoses being ignored. I spoke with one Ryerson University student union leader who says that just last year, in the first 8 months, there were 15 overdoses, 8 of which were related to fentanyl and heroin. So now there's an increased push on making the medication that reverses overdoses more available.
Students use drugs, right? We know that students use drugs, and there's this stigma around the idea that drug users aren't students, that drug users aren't professionals. And I think it decreases a lot of folks from accessing resources and reaching out because they're afraid of that stigma kind of being broken down, or they're scared of being kicked out of school, or for a lot of different things.
What do you think universities, unions need to be doing?
Yeah, I think all student unions, it should be mandatory that all of their staff and executives be trained in naloxone. We know that with naloxone, there's about only really like a minute window or under to actually save that person. So it's not enough just for campus security to be trained or for the medical center to be trained, because when we're talking about overdoses, the frame of time is so small. So everyone should be trained.
What do you have to talk to people about opioids?
Yeah, so we're really fortunate to actually have the Works really close to campus, which is a public health organization, and it's just located on Victoria Street. So we have some of their resources here, and it talks about getting trained in naloxone, and that's basically what we have. It's the closest and easiest way for students to be trained.
While there were 15 overdoses here on campus last year, Olson says that there could be more, considering many students choose to do drugs off of campus. Now, we spoke to students here at Ryerson University to see whether they think the university is doing enough to address overdose concerns. Your first-year students, has anyone talked to you about safety regarding opioids on campus?
Yeah, there was a booth set up on my first day here, and they were giving out pamphlets about signs of people who have possibly overdosed and things, and they were also telling us where we could find kits that we could give to someone if they had overdosed.
I have friends who take opiates too, but of course they've never overdosed on it. But I feel like if there's more information surrounding it, and I feel like people would know how to be safe with it.
Do you think the university is doing enough to spread awareness about drug use and what the dangers are?
I mean, I don't think they're doing much, but I don't think it's that necessary. I feel like we get a lot of information from outside of the university. I think, as an adult, it's your own responsibility, kind of, to...
What about you, Lucas? Do you think the school should be doing more to talk to students about it?
Yeah, definitely. I haven't really heard too much about it, actually, at all, really. So, yeah, I think so, definitely.
Olson says that there is some progress being made this year. New, Ryerson Security is now able to use naloxone kits, all the security, and that is definitely something that Olson says is a good sign. Things are moving in the right direction.